This is Kisoro Main Hospital in Kisoro District, southwestern Uganda. The number of patients is overwhelming, with many waiting in line for hours to access treatment. Kisoro District is sandwiched between Kabale and Kanungu districts, as well as Rwanda and the Democratic Republic of Congo, so the hospital receives patients from all these areas.
Even when there is apparent peace in Congo, people are flowing in because of internal insurgencies. So the issue of refugees, when they come, they also impact on our healthcare delivery.
And we are developing countries. And generally, the Congolese are Africans, the Rwandese are Africans, and at times, with our porous borders, they may even avoid these custom areas, and then they walk in.
Although Kisoro Hospital, unlike many other public hospitals across the country, boasts a moderate staff level of 70%, the general efficiency here is still lacking. The ratio of health workers to patients is poor. There is also a large deficit of qualified doctors, no radiographers, and few enrolled midwives.
The main deficits are in doctors, because out of the 9 positions that should be filled at the hospital here, we're only 2 that in those positions. The other positions that lack are the specialist positions, like now radiography. Of the 2 positions we currently don't have, because it's very difficult to attract people like radiographers to a rural place like this one.
The situation is worse in the inpatient department, with the number of patients rising daily. Here in the male ward, some of the patients considered to be in a fair state are lying on the ground because the beds are inadequate. Even the building housing the ward is dilapidated, with crumbling floors and roofs falling apart. The few medical workers here are overstretched, attending to the hundreds of patients daily.
The outpatient department probably sees between 5,000 to 6,000 patients a month. Now, that will translate to you to about 200 patients a day on average.
The pediatric ward is also in a sorry state, with no pediatrician and just 1 oxygen concentrator.
Like the oxygen concentrators, we have 1, and we should be having 3, because we receive more than 1 children who have respiratory distress. Some of them have pneumonia, severe pneumonia, with a low saturation of oxygen, and we need to put them on oxygen therapy. So we find we supply to 1 because we will have only 1.
According to the Kisoro district chairman, most of the government employees in the district lack basic training in management, which is hindering effective service delivery.
Every doctor, every clinical officer who leaves school, some of them don't have management skills, are not trained to be managers, are meant to be in charges. A doctor is thrown in a hospital, a clinical officer is thrown in a health center or somewhere, and you find these are young men who have really challenges of self-management themselves.
The leaders say, although they are trying their best to find solutions to the problems plaguing the district, government needs to do more in this regard.
When you go to, for example, to the Ministry of Public Service, they ask you, yes, you want to fill these categories of health workers. What does your wage say? We need to cater for all of them. And if your figures do not tally, they will tell you, no, we don't want you to recruit people who will work and not get paid.
As the struggle to improve healthcare in Kisoro continues, the southwestern Uganda district, that is a hotbed of tourism with many tourist attractions, still has a lot of potential with its beautiful lush green rolling hills and steep slopes. Suhail Mugabi, NTV, Kisoro District.